Hey, how's it going? Now that we looked over the x-rays, I'm going to go over this new patient packet we always give to our new patients. It has tons of great information about chiropractic in here. When you open up in here, it has lots of good facts. One of the major things that was very important of is that WaveMD recently did a study of almost 2 million people. We have a 95% satisfaction rate. So very good stuff all through here about cutting the cost of health care, cutting the need for surgery or hospitalization. Tons of good stuff you can look through this area. When you open up, here's of course for all the doctors. We have Dr. Garza, Dr. Rupert, Dr. Tobor. We all do the same adjustments and treatments. We have meetings in the mornings and afternoons before people get here. That way everybody's on the same page. So everything goes very smoothly and you get in and out very quickly. This is the financial portion part of it. The only people that really know the ins and outs is Tina and Amanda up front. They do a very good job. They'll answer any of your questions you have about the financial stuff. We completely stay out and try to focus on health care. When you look through this area, this is what you saw in the video. This is subluxation. Same thing as misalignment. It's just when a bone is pushed out of place, it puts pressure on the nerve, causes pain and symptoms. Also, there's tons of muscles that attach to each one of these. So our focus is going to be on putting the bone back into a good functional position, taking pressure off the nerve, and then we're going to stretch out these muscles to make sure they don't continue to cramp up, give you the same pain and symptoms. So that's what our focus is going to be on. And now we've looked at your x-rays, so this will make more sense now that we're looking at this portion. We're going to stop the degenerative process. Now you can see these are discs in between here. They're just like little jelly donut shock absorbers. Now over time and wear and tear, you start to see these shrink up, start to put down calcium deposits until they fuse together. At this point, all we can do is work on above and below, because once it's fused together, there's nothing we can do about it to keep that segment motioning. You're somewhere around phase 2, so we need to get some of that reverse back to phase 1. We can never make it brand new, but we can get some of that calcium to resorb back and continue to improve the motion of those segments, making sure those discs stay nice and healthy. Same thing we're looking through in here. These are x-ray pictures. This is the normal. We look at a few things like the curve of the low back, making sure the weight is distributed equally on front and back portions. You can see the disc spaces like yours are very good, and the holes where the nerves come out like very clean and open. Now through time and wear and tear, like we talked about, you start to see thickening of the borders through here, the shrinking of the disc space, and you can see the holes get very cloudy. Right here you start to see these little bridges start to come across and try to fuse that area together. And right here this guy has this whole area fused together. We can still work on a few areas above and below. We want to make sure we get this area back into a normal position for you, okay? So when you open up to the back portion, so why do you feel this way? It's not actual nerve damage that's going on, just the nerves are irritated. And a lot of times when people have that, muscles start to change and tighten up to protect that area. We need to focus on getting that to relax to continue to improve the function and improve the motion of each of these segments. No tissue damage where you need to see orthopedic surgeon. If you're not responding to treatment, we get you the best people out there, but you should do very good with conservative treatment that we have planned out for you. And normal people just get this way from spinal wear and tear, your daily activities, your hobbies, your routines. All put your body under stress, and it usually only takes one little abnormal motion to start off the pain cycle, and that's what we need to focus on getting you back after all that stuff starts to cramp up and stuff starts to not move around as well. Also, we have your myovision scan right here. We don't actually have it right here. Maybe we do, no we don't. So this is a good printout that we do of where there's muscle tension relation from one side to the other. The most important thing, this is an ideal example. The most important thing is symmetry, okay? If we see muscles tight on one side or the other, like yours has, in the nerve and the low back portion, we know that there's some kind of imbalance that we need to focus on. We'll do more of these throughout the treatment to make sure it continues to improve tension-wise on the other side. This other scan we do is the thermal scan. It shows where there's extra body heat being produced from one side in relation to the other, and that's showing where there's more inflammation, more body's breakdown of material so that later it can put down new material. We want to make sure that you're always heating up, always putting down new tissue, so we want this to be a straight line. So again, we'll do these throughout the treatment plan, making sure you're on the right track for progress. With all that said, this is our treatment plan. This is our game plan. This is any kind of contract. This will give you the best results as quick as possible. So this is what we highly recommend. Now, it goes through 3 different phases. The first phase, of course, is always we got to get you out of pain. We're going to be very aggressive, try to get you in 3 times a week, so that way your body continue to improve very quickly. And we said about 4 weeks you'll be pain-free, okay? At that point, we move on to the correction phase, where we show you lots of stretches and exercises you can do at home. So at that point, we're going to cut back your schedule to only twice a week, and then you should have all that down within a 6-week period, maybe even a little bit sooner than that. The last phase we do is stabilization. That's where you come in just one time a week so that your body could hold up what we have, so eventually we can get you to maintenance care. And that's our primary goal, is to get you to where you can hold on a month, maybe a little bit longer without needing to come back, without any setbacks whatsoever, without any pain. So that's our primary goal. So this will give you the absolute best results. So try to stick to this as close as you can. If you do happen to miss a few appointments, make sure you try to make them up as quick as possible. We don't ever want to see you falling back to square one with all that pain that you first had. Also, keep up these stretches and exercises. You'll have tremendous results if you keep these up. Just easy little things you can do at home to keep you progressing throughout time. And also, we have this How to Stay Young class that we require all our patients to come to. There are different times throughout the weeks. If one of these times fits your schedule, we put you in. It's fun, interactive course. Has some very good information. It's only about 15 minutes long. We do it in this room here. A few more papers here. This is our appointment policy. It's just saying that our time slots are very limited. So if you can't make your appointment, just please give us a call, heads up. That way we know we can give someone the next best available appointment, give you the next best available appointment, and give someone else the opportunity to just come in whenever you can't make it. This next one is what to expect after treatment. We plan on doing a full treatment on you today. Yeah. This is what to expect. You may not have any change at all. Sometimes it does happen. We're expecting you to feel great. Sometimes you may have a little bit of soreness, usually no more than if you start a new exercise. To limit that soreness, try using an ice pack for about 15-20 minutes, no more than that. Do not use a heat pad or hot tub. That's going to bring up more inflammation. Like we talked about, the more heat, the more blood flow, the more pain. This is a little thing saying, I want you to stay active, but stay away from doing anything exertion-wise. You know your limits. Try not to overdo it throughout this period. If you do need a doctor's note, let us know when you get here. That way you don't have to wait around. We have it ready for you before you leave. This is our office number. If anything comes up whatsoever, any questions, concerns, please give us a call. We'd rather talk about it before and steer you in the right direction, whatever questions you may have. The last three things just say that everybody responds differently to treatment, so communicate with us. If we need to change something up, we can. We absolutely will. We just need to know how you're doing from time to time. Make sure you progress in the right way. And this last is a little gift certificate we give out. If you have a friend or family member, like your cousin that you was talking about earlier, if they want to come in, if they do a donation, we'll do the history, consultation, exam, x-rays. We'll show them all that material for absolutely no charge. So it'll be a good little way to get them started up with good health. Okay? So, any questions besides that?
No, great.
Great. Well, I have Ms. Tina or Amanda come in and talk to you about the best scheduling times for you and any questions about the money portion of it. Okay? Thank you very much.
All right. Thank you.
Thank you.